Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one more important topic under cardiovascular system. So let's dig into it. And before going to the topic, Happy New Year to all of you guys. Okay, let's back to the topic. This is the video of introduction to the cardiovascular system examination. This is not for those who has already read the topic. This is for those who is like first time reading about cardiovascular system, or you want to know the introduction part, how the cardiovascular system examination will be there, or you want to understand the headlines or index. Just this is like an index of the cardiovascular examination. If you have already read once or you know perfectly about the cardiovascular system examination case presentation thing, you can just skip this video. This is not for you people. Basically, I'm focusing the people, students who are going to present the case, like they don't know anything and they are in second year or third year and they want to present a case and they just want to answer some questions which rarely people ask when they were second year or third year come to postings. We don't ask that much detail. We just ask what all comes under the what topic. So I'm going to just brief about the cardiovascular system examination. So let's look into the topic. And this is one of the important topic. You people get confused under what topic you are going to get what subtopics and all. So let's make it simple. You have hundreds of pages when you read a standard textbook related to cardiovascular examination, but I tried to concise it according to that whichever I felt important you need to know under the main heading. So let's start. So this is like cardiovascular examination is a systemic clinical assessment used to evaluate the structure and function of heart and peripheral circulation. This is what cardiovascular system you are going to learn. Complete cardiovascular system is related all about heart and its blood supply. Okay, then coming to components of cardiovascular system examination goes like this. It's like a regular case, and every system there will be a small part change will you are going to notice when it comes to examination part. Other general physical examination or you or HOPI and all, everything will be same. There will be nothing more changes will be there. Just like simple terminologies will change when it comes to respiratory or when it comes to CNS. CNS is completely different. We'll look into that thing in neurology topic, but I'm just briefing how it will be. Most of the time, about 50% of the cases will be similar in all of the systems, but only a small part will be changed in the examination part. So let's focus mainly on that examination part, what you're going to learn under the main topics. So first you are going to see history. Then coming to second part will be general physical examination. Examination of pulse you are going to see. Then obviously blood pressure. When it comes to heart, you need to check pulse, blood pressure, and other things we'll discuss detailedly. Like I'm going to make a separate individual videos about these topics because these are completely separate 5-marker questions in cardiovascular system. So let's not make this video big. So I am going to make a separate videos under the main topics for 5 markers, which will help for you people to even study for the theory things. JVP is an important topic again. Precordial examination, this is what it changes from other system or the case presentation. Then auscultation, main important topic. Like this is where you people prefer stethoscope more than other systems because auscultation plays very important role in cardiovascular system. Then peripheral vascular examination we are going to do. Then in history, what you are going to mainly focus is like patient comes to OPD with a chest pain usually or some breathlessness, and this is one of the DD with a respiratory case. Then palpitations, syncope, pedal edema, and cyanosis. These are the actual presenting complaints like patient comes to the OPD. Then when it comes to chest pain, you need to see site of the chest pain or where it is radiating because radiation explains about what is the actual cause superficially without any investigations. Then character, duration, it is also important. Then aggravating and relieving factors, like mainly chest pain, we are going to focus mainly on the angina. We want to rule out angina. There are various types of angina. We will discuss in that individual video. Then coming to associated symptoms which are related to chest pain. Then coming to breathlessness, this is one of the important DD we are going to just rule out in casualty, usually with the whether it is the case is really actually related to cardiovascular system or the respiratory system. So dyspnea on exertion, orthopnea, I know these are like some medical terms which you people don't know, but slowly we'll learn. When if the person who is seeing this video is studying second year or third year MBBS, no need to worry. You're going to study everything in detail and you have to study. You will study anyway for your fourth year final exam. So no need to worry, no need to dig more things. What is this dyspnea, orthopnea and all? Just sit and relax, listen. There is something called dyspnea or orthopnea. Then PND, paroxysmal nocturnal dyspnea. In palpitation, you are going to see onset, duration, regularity, associated dizziness or syncope. Then coming to past history, as usual, you know, past history means hypertension, diabetes, rheumatic fever. When it comes to what you say, CVS cases, you prefer rheumatic fever. Most commonly, when you suspect a respiratory case, you are going to ask the patient any TB history or something, asthma and all like that. In CVS cases, we prefer to ask rheumatic fever and all. Previous MI, MI is the most common cause where people comes to casualty. Like people feel that I'm going to die. That instinct will bring the patient to the casualty. So that is most common. You need to ask in the past history. Then coming to family history, there are primary and secondary which you are going to study in PSM and all. They are related to hypertension. So in family history, you can ask it. Coronary artery disease, it is one of the most thing you need to ask in cardiovascular system when it comes to family history. Then any sudden cardiac deaths, like we will get some extra bonus. So in your what you say point topic to rule out some other degrees of the actual condition. It saves the time. Well, like when it comes to cardiovascular system cases in the casualty, you have to save the most of the time of the patient so that the patient won't face the problem severely. Then coming to drug history, as usual, I said like past history, if he is having hypertension, then he'll be on the obviously like he'll be on the antihypertensive, anticoagulants, cardiotoxic drugs. Then general physical examination, this you can remember as pickle. I think you learned in a physiology, pickle, Fowler, icterus, clubbing, cyanosis, edema. If you people want more detail about this general physical examination, you can ask me in comment section. I'll make a separate video. Actually, this is purely a physiology topic. But if you want, I can make a video. When people ask, and I can't say no, right? Yeah. Vitals, you're going to check pulse rate, rhythm, and study more detail about pulse because it has so much to study. I'll try to what you say make it short and make a small note so that you can revise well during your final practicals. As soon as possible, I'll be uploading those videos. And coming to blood pressure, then RR, respiratory rate, you need to know the normal rate and all. Then coming to oxygen saturation, most of the time we will use pulse oximeter regularly to check the oxygen saturation. And when the patient is in ICU, we'll check the saturation in the monitor itself. Then coming to examination of pulse, as I said, we preferably check radial pulse. There are many other sites like carotid pulse, which is most commonly used for scientific research purpose or some emergency where you are unable to find the radial pulse. Like that, in pulse, if you want to study more rate, rhythm, volume, character, there are actually 7, but I prefer these are the more thing like you need to know more. Some other will be like radial delay, radiofemoral delay. You have to know the causes. There will be aortic coarctation and all, but just remember these 4 are more important. Then coming to special pulse character, like you need to know how pulse is like. You can feel it like slow rising pulse or bounding pulse, birefringence, or even pulses alternance, pulses paradoxes. Like I'll teach you in pulse topic. No need to worry. Just I thought like I can give a brief topic about these names. Then coming to blood measurement, you need to check. Ideally, we ask the patient to sit for 10 minutes. If he came from a walking or we are getting a high reading, we'll ask the patient to sit for 5 minutes or 10 minutes. Then we'll check him in a sitting position. We have to give the sphygmomanometer BP apparatus accurately to the level of the heart so that there will be no more variation or error. And we preferably check in right hand so that we'll get proper measurement. Like in OPD settings, it varies, but I prefer on right hand. Then we can check in supine and standing. You people did so much drama in the physiology experiments. You know that maybe I forgot more than you. You people will be knowing more than me. If indicated, then note systolic and diastolic values. Usually we write 120 by 80. This is systole, this is diastole. Okay. Then coming to jugular venous pulse, we have method to check how we are going to measure the jugular pulse. Patient at 45 degree, observe right internal jugular vein. There will be scale we are going to keep and we are going to measure it with it like that. I'll explain this in jugular venous pressure topic. There you are going to learn various waves A, C, V, X, Y. No need to worry. I'll be explaining. Just remember, jugular vein is directly impact of right atrium. That's it. You just remember this much. Usually, ideally, normal JVP will be less than or equal to 3 cm above the sternal angle. Then coming to important part of the CVS is precordial examination. First thing you need to know when it comes to examination part of systemic examination, you need to go with the 4th thing. First, you need to do inspection without touching the patient. You are going to examine the patient. That is, like if the patient is walking inside or made him to sit comfortably, then you are going to ask him to open the site where you are going to do the examination. For CVS, you're going to check from the front side. You have to ask the patient to remove his shirt and sit on the chair. Then you have to inspect without touching. First, you need to know what all you should know without touching you need to see. So in inspection, you are going to see visible apex beat, precordial bulge, or any surgical scars. Like surgical scars before did he undergo any cardiac or any other surgeries on the actual site. Then coming to palpation, here you are going to test the patient. Apex beat location, like if there is any pulsation you are going to see, then you have to make the accurate side where it is actually felt. Then heaves, thrills, no need to worry, I will be teaching this. Then coming to next will be percussion. This is like important part, percussion. Ideally, they say that we should not percuss in cardiovascular system. Percussion is mainly we prefer in respiratory system. There are many subtopics in respiratory system coming to when it comes to percussion. But in cardiology, we preferably don't do percussion just because we'll say that like if there is any embolus, if we percuss and it may dislocate and it may cause complications further. So preferably we won't do. Like it depends on the externals, but for me, it's okay if you don't learn more about percussion in the cardiovascular system. But when it comes to auscultation, you need to know very detailedly because cardiovascular system is like almost same. Like you can say cardiovascular system equal to stat equal to auscultation. You need to know more thing in auscultation. So what you have to see in auscultation is areas. We have mitral area, tricuspid, aortic, and pulmonary. We have accurate sites where you need to know where we are going to check these areas. No need to worry. I'll make separate video on this because murmur is an important topic which you will understand after the knowing more about these areas. So then we have heart sounds. This is a physiology topic. If people want more details from my side, I can teach it. So we have 4. S1, S2 is normal. If S3 is in some condition, it is normal. S4 is completely pathological. You need to know the causes because when it comes to cardiovascular system, auscultation part, you need to know detailedly. Then coming to murmurs, this is one of the very important topic. Like I'll be teaching very detailedly this murmur going further videos. Okay, just follow the playlist. Like you are going to get almost all the questions which you are going to face in during vivas or even in final year exams. Murmur, you are going to see timing, intensity, pitch, radiation. Then coming to other cardiovascular, like extra you need to know is peripheral vascular examination, peripheral pulses, capillary refill time, peripheral edema, varicose veins. Then coming to systemic examination, like these all are like under cardiovascular system. Then coming to other, like if a patient comes to you, when he says chest pain, you need to examine other systems also so that to rule out any contributing factors are there or not. So you're going to do other examination, but preferably we prefer more focused on cardiovascular system when it comes to cardiovascular systems case. We are going to see respiratory system also, and then obviously abdomen. Then coming to CNS, if any embolic event suspected. Then at last, I know it was a lengthy video, but I think you people understood well. So at last, something you need to know from this video is integrates history and physical findings to localize cardiac pathology and guide for further investigation. So this is like these things you can't do completely in the casualty. The examination part will be usually done in the OPD basis. But when it comes to casualty, you need to be so quick and it will be done by experienced people. Experience matters in the casualty. So you can't ask why you have chest pain. Did you have any hypertension in the casualty, right? You have to be quick if the patient and you have to treat according to the severity. As I gave examples, JVP reflex, I said like it will be related to right atrial pressure. Then coming to apex bit position indicates cardiac enlargement because it is the least tip point you are going to visualize in your of the heart. So if there is any displacement in the apex bit position, it signifies that there is a cardiac enlargement. Then murmur timing helps valve localization because it is completely related to valves. So if there is any change in the timing or something, then it signifies about valve issues. So I think it was a lengthy video, but it is useful and it is important. So we learned briefly about history, then general physical examination, pickle, pulse, 7 components, then blood pressure management, supine or sitting, and on the right or both hand you can monitor. If I prefer right hand. Then coming to JVP, various waveforms and right atrial, significance. Then precordial examination. Then coming to auscultation, areas, murmurs, and sounds. Then peripheral vascular examination. I hope that was clear and don't skip any part. Just look, if you are 4th year also, just see the video completely so that you'll be remembering something. Like if you skip, you need to know what topic comes under the heading. Okay. I try to compile all the important topics under the heading. So that's all for the video. Subscribe for the channel. Don't forget, like it and share. If your friends are facing any problem, you can share the video. That's all for the video. Thank you. Happy New Year once again.